Hello, my name is Juliana Henry and I'm the Director of Midwifery Services here at Sligo University Hospital. Congratulations on the birth of your baby. I hope that you have enjoyed your pregnancy and birthing experience here with us. The following video is to help you to navigate through your postnatal journey. It contains relevant information to help you in the first few days and weeks after giving birth. We wish the very best for you and your family.
My name is Marla Kennedy. I'm the Antenatal Education Midwife Manager and I provide parent craft education here in Sligo University Hospital. You will find it both rewarding and demanding caring for your new baby. It's all too easy in the excitement to forget about your own health. With everything focusing on the birth, you may not have given much thought to what happens afterwards. Everybody bleeds vaginally after the birth of their baby. Lochia describes the discharge from the womb as its lining is shed following birth. For the first 2 to 4 days after the birth, the loss will be red and heavy, similar to a period. And during the first week, the loss will diminish, becoming more brown or pink in colour. After about 2 to 3 weeks, the loss becomes creamy brown, clear and eventually stops. If you do notice that the loss has an offensive smell, becomes heavier or bright red after the first 4 to 5 days, tell your midwife or public health nurse so they can make sure you do not have an infection. Your next period may start again within the first 6 weeks, although if you're fully breastfeeding, this may be delayed.
You may feel mild contractions in the first few days after delivery as the uterus shrinks back to its pre-pregnancy size. Painkillers, such as paracetamol, may relieve the discomfort, but take care not to exceed the recommended dose. If you have torn the perineum, the area around the vagina opening, or have had an episiotomy and stitches, you are bound to feel sore and uncomfortable for the first few days. Make sure that you take medication to relieve the soreness. If you have had stitches, these take about 2 weeks to dissolve. Clean the area after going to the toilet. Avoid constipation and drink plenty of fluids in order to keep your urine dilute and reduce the stinging. After a caesarean section, you may find it takes longer to recover your physical health and strength, and this is entirely normal. For the first few days, the midwife will examine your wound to ensure that it is healing. The main thing to remember is not to overstretch, lift heavy objects, hoover or drive in the first 4 to 6 weeks.
It is normal to feel tired after having a baby. Ask for help from family and friends. You have enough to do looking after your baby without having to worry about guests. Remember that your hands and feet might swell after your baby is born. This swelling is due to excess fluid present in the body and goes away usually within a few days. However, it can be very uncomfortable, especially in hot weather. Try to make sure you have as much rest as possible and elevate your feet while sitting. This does relieve the pressure of the fluid in your legs. Remove any tight-fitting rings if your fingers swell. During pregnancy, some women report that their hair has never been in such good condition, while others say the opposite. In the postnatal period, most women do notice some hair loss though, and this is usually very mild, so use hair products which are best suited to your hair type and ask your hairdresser's advice before having a colour or a perm. If you developed stretch marks on your abdomen or thighs or a dark line down the centre of your abdomen during pregnancy, this should fade once the baby is born. But stretch marks never completely disappear, however, and they do fade to a pale, silvery colour and thereafter difficult to see. After giving birth, your health is as important as that of your baby, so take time to discuss the challenge of motherhood. Always ask for help, even if the problem seems small. You and your baby need time to get to know each other, and that's best done when you're both in the best possible health. we also recommend that you link in with your local parent and toddler groups.
Hi, I'm Lynn, the Infant Feeding and Lactation Nurse Specialist here in Sligo University Hospital. I'm here to help you plan your baby's feeding journey during your pregnancy and following the birth to ensure you have the skills, confidence and support to breastfeed your newborn successfully. Breastfeeding is the best start you can give your baby in life. Any amount of breastfeeding has a positive effect. The longer you breastfeed, the longer the protection lasts and the greater the benefits. You will soon learn your baby's hunger cues. They will flutter their eyes, stick out their tongue, bring their hands to their mouth, make mouth movements and wriggle or move towards your breast. Crying is a late feeding cue. There are various ways you can position your baby to breastfeed. No one way is best. The right way is what works best for you. Having a baby who attaches well to the breast can prevent many breastfeeding problems. Therefore, it is worth spending time getting it right from the beginning. You need to bring your baby close and facing the breast directly, with their nose level to your nipple, tummy to mummy. It is uncomfortable and tricky for your baby if their head is twisted, so keep their head and body in a straight line. Avoid holding the back of your baby's head. You can support your baby's neck and back with your forearm. Gently brush your baby's mouth with the underside of your areola, the dark part around your nipple. Your baby should respond by opening their mouth wide with their tongue coming forward over their lower gum. Quickly bring your baby to the breast with your nipple aimed at the roof of their mouth. Baby's chin should touch your breast first on your areola, well down from the nipple. The wider their mouth is open, the deeper the latch should be. Your nipple and a large part of your breast should now be in your baby's mouth. Your nipple should be far back at the soft palate of your baby's mouth. If your baby only takes the nipple into their mouth without a good mouthful of breast, they won't be able to feed effectively and it will probably hurt. Your baby's cheeks will be full and rounded and they should begin to feed. You will start to see your baby suck and swallow rhythmically. Now try to relax back, bringing your shoulders down. This will help your letdown reflex and promote your comfort. You may feel some discomfort and sensitivity in the early days as your baby attaches, but as the milk starts to flow, this will settle. If your breasts are engorged, it can be difficult to latch your baby. Massage and a little expressing before offering the breast can soften the area, making it easier for the baby to attach. Sore, grazed or cracked nipples usually mean your baby is not attached properly and has caused some damage. A poorly attached baby may not be able to drain your breast fully, which may affect your supply and lead to an unsatisfied baby. If you notice your baby's cheeks are hollow as they suck, clicking sounds, they keep slipping on and off the breast, or that it hurts while feeding, you need to take your baby off and reattach and possibly change their position. To do this, place a clean finger in the corner of your baby's mouth between the gums and break the suction and release your nipple. Because breast milk is designed perfectly for your baby, it is quickly and easily digested. Feeding frequently in the early days and weeks helps make sure that your baby is getting enough milk and that your body is making the right amount of milk. Feed your baby as often as they want, for as long as they want. This is called responsive feeding. It is common for newborns to feed at least 8 to 12 times in a 24-hour period, including during the night. This means you will be feeding every 2 to 3 hours, which in the beginning can feel like you are doing nothing but feeding. But gradually, you and your baby will get into a pattern and it'll settle down. It is a good idea to offer both breasts at each feed to ensure baby gets an adequate amount. The length of a breastfeed will be determined by your baby's interest and response. Allow them to actively feed for 10 to 20 minutes on one breast. After this time, the milk flow normally decreases and your baby will lose interest or doze. After a burp, a nappy change or a cuddle, offer them the other breast. Then, at the next feed, reverse this order, offering the breast last fed on first. Many newborns have periods where they feed very frequently for a few hours. Often, these cluster feeding periods are followed by a longer period of sleep. If your baby is extra sleepy, you may need to wake them to ensure they get the milk they need. It is good to remember that feeds are not just for nutrition, but also give comfort and reassurance to you and your baby. It is normal for mums to worry about whether the baby is getting enough milk, and it may take a little while before you feel confident they are getting what they need. We can't measure how much the baby is getting, but even in the first week, there are some reliable signs that your baby is getting enough. Put simply, what goes in must come out, meaning their nappies can reassure us that baby is feeding well by noting how much and how often your baby wheezes or poos. After 5 days, your baby should be having at least 5 wet nappies per day, and the urine should be clear in colour. Their poos should be regular, soft, and a yellow mustard colour, about the size of the palm of their hand. Observe your baby during feeding. They should start with a few rapid sucks, followed by more long rhythmical sucks and swallows with occasional pauses. You can hear and see them swallowing. Their cheeks stay round, not hollow, during sucking, and they seem calm and relaxed during feeding. When finished, they will come off the breast themselves and their mouths look moist. You should notice your breasts feel softer and your nipples look unchanged, not flattened or pinched or discoloured. Additionally, well-fed babies will be alert with good muscle tone and have a good colour and look like they fit in their skin. After 10 to 14 days, they will start to gain weight and their clothes will become snugger. They will have some content times during feeds, but fussy periods are normal baby behaviour too, and not necessarily a sign of a baby who is not getting enough milk.
Hi, my name is Sylvia and I'm a midwife on the postnatal ward. Today I'm going to discuss infant formula feeding and demonstrate how to prepare your baby's bottle. There are 2 forms of infant formula: a ready-to-feed liquid which has already been prepared. Although convenient, this tends to be a more expensive option. A dry powdered form which needs to be made up with water, which is more cost effective. Always read the instructions fully. This is to ensure you prepare the exact amounts of water and formula that your baby needs according to their age. Speak to your midwife or public health nurse if you need any advice. So to prepare a formula feed, begin by washing and drying your hands and cleaning your work surfaces. Sterilise all of your equipment. You may be using a steamer, boiling water method or a chemical steriliser. To start, fill the kettle with fresh tap water and boil it. Leave the water to cool in the kettle for 30 minutes. This ensures it remains at a temperature of 70 degrees, which is the ideal temperature to destroy any potential bacteria in the formula whilst maintaining its quality. To prepare the feed, pour the correct amount of boiled water into the sterilised bottle. Double check the level is correct. Using the scoop provided, take a scoop of formula, level it off with a clean knife or the edge of your tin and add to your water. Add the exact numbers of scoops to the water as per instructions. Reassemble the bottle and place the cap on tightly. Give it a good shake to mix the contents and ensure the powder has dissolved.
To test the temperature, place a few drops of milk on the inside of your wrist. It should feel lukewarm but not hot. You can cool down the feed by holding the bottle under a cold running tap or leave to stand in a bowl of cold water until cooled. To heat up your prepared bottle, place the bottle in a bowl of warm water and remember to check the temperature before use. Discard of any unused milk within 2 hours of preparation. It is considered best practice to prepare a fresh feed each time. However, if you need to store made-up bottles, it is advised to cool quickly and store in the back of your fridge for 24 hours. Paced bottle feeding is a technique that controls the flow of milk coming out of the bottle, so your baby can feed at a comfortable pace. It can prevent overeating, gulping or choking, and reduces wind. Make sure you are sitting comfortably with your back supported and your baby held close to you. Hold your baby in a semi-upright position, the head nicely supported and where you can see their face. Brush the teat against baby's upper lips. When your baby opens their mouth, gently advance the bottle in a horizontal position and allow the baby to draw the teat into their mouth. After 20 seconds, tilt the bottle down. This controls the flow, slows the feed, which reduces gulping and overfeeding, therefore allowing your baby to drink at their own pace.
Hello, my name is Marcella and I'm a midwife here in Sligo University Hospital, and I'm going to show you how to bath your baby. Bath time is a chance for you to bond with your baby, have fun and play. A bath 2 or 3 times a week is enough to keep your baby clean. Firstly, make sure the room is warm, that you've gathered all the bits that you need: fresh clothes, towels, cotton wool and a clean nappy. Fill the bath, the basin or the baby bath or the sink between 8 and 10 centimetres of water. The water should be just high enough to cover the baby's tummy. Make sure the water is the right temperature, roughly around 36 degrees. Use your elbow to test the water. If it's too hot for your elbow, it's too hot for the baby. Undress your baby, but leave it in the nappy. Wrap it in a towel and place it in a rugby hold over your hip. Bring to the bath and use cotton balls to clean and wipe one eye at a time. Wash the face and wash the hair. We don't use anything other than water for this. Bring the baby back, dry it off, dry its head, get it underneath the creases. Then you can remove the nappy. Place your arm underneath the baby's shoulders and head, locking your wrist around the baby's arm. Lift the baby with your arm underneath the bottom, bring to the bath and lower slowly into the bath so that the baby doesn't feel like it's falling. When the baby's bottom is resting on the bottom of the bath or the basin, you can remove your hand and use that hand to wash the baby. After you've bathed the baby with your free arm, you can lift the baby back out, placing your free hand underneath the baby's bottom, holding its legs, because they are very slippy at this time. Place back on the towel, pat them dry. Don't forget to get underneath the skin folds and creases. Redress your baby with fresh nappy and empty your bath water.
The safest place for a newborn to sleep is in a cot in the parent's room for the first 6 months. Put your baby to sleep on a firm, flat mattress that fits tightly to the edge of the crib or cot. The room temperature is important. The ideal temperature should be between 16 and 18 degrees Celsius. If you are comfortable in the room wearing light clothes, then it will be comfortable for your baby. Keep the room at an even temperature throughout the night. It is important not to position the cot by a radiator or heater or in front of a very sunny window. Cellular blankets are recommended. Keep toys out of the baby's cot. Ensure the plastic covering has been taken off the mattress. The important message is, put your baby on their back to sleep in the feet to foot position. This ensures their feet are at the bottom of the cot so they can't slip down under the covers. Make sure the blankets come no further than the baby's chest, tucked loosely but securely to make sure they cannot slip over the baby's head. Check your baby regularly to ensure their head stays uncovered.
My name is Siobhan McDonough and I am a midwife here in Sligo University Hospital. All babies cry and some cry more than others. It is normal for a baby to cry. Crying is their way of communicating with you. Each baby is unique. It can take you time to figure out why your baby is crying. Sometimes there may be no obvious reason why. When trying to soothe your baby, try thinking about possible causes, like trapped wind, hunger, or a dirty nappy. To soothe your baby, pick them up and try different positions to see which they prefer. Or give them a soother to help pacify them if you're using one. Play gentle music and background noise, such as white noise. If you are able to remain calm, it will help your baby settle. When feeding your baby, it is important for them to take short breaks to burp and relieve wind. When they have wind, they are unsettled. They may arch their backs and draw their legs up. The best way to burp your baby is to hold them in an upright position against your shoulder, rubbing or patting their back. You can also try propping your baby on your lap, leaning forward, supporting their jaw and head, and rub or patting their back. If your baby cries a lot, they may have colic. Colic is when your baby's crying begins and ends for no obvious reason. It lasts at least 3 hours a day, at least 3 days a week, and continues for 3 weeks to 3 months. Colic is temporary and should resolve with time. Talk to your GP if your baby is crying constantly. If their cry sounds different to normal, they are crying especially around the time of feeding and not gaining weight, or if you feel you are not coping.
Changing your newborn's nappy is one of those things you'll be doing 7 or 8 times a day, so it's best to be organised from the start. Make sure you have everything you need ready and close to hand. Place your baby on a clean, soft, flat surface. Open the nappy and wipe away excess stools from the genital area with the corner of the nappy. Hold your baby by the ankles and lift up their bottom. Use soft cotton balls or a wet cloth to clean your baby. Clean around the umbilical cord area. For a girl, be sure to wipe from front to back. This will help minimise the spread of an infection. Swap a clean nappy for the dirty one. Use the tabs to see which way goes up. Avoid covering the umbilical cord as this can cause irritation. For a boy, keep his penis pointed down. Fasten the nappy at both sides with the tapes, making sure it's snug, but not so tight that it pinches the skin. Retape the soiled nappy around the contents, put it in a plastic bag and discard it in the bin. Dress your baby and wash your hands thoroughly. Babies wet their nappies several times a day. The number of wet nappies is a helpful sign of how much fluid the baby is taking in. Generally, a baby should have 5 to 6 wet nappies each day. This is a good indication that they're getting enough milk.
Hello, my name is Joanne Kilfeather and I'm a physiotherapist specialising in the area of pelvic health and continence.
The key messages to remember over the coming weeks will depend on whether you had a vaginal or a caesarean delivery. If you had a vaginal delivery, there has been a significant amount of stretch and often trauma to the muscles of the pelvic floor. So start working on the pelvic floor exercises early, as this will not only improve muscle function and continence, but also increase blood supply and healing to the muscle. If you have had a caesarean delivery, your scar will need time not only to heal, but to reinforce itself and make it stronger. So to assist the scar in healing, support your wound site whenever you cough, sneeze or laugh, and remember to roll onto your side to get in and out of bed, especially when you awaken at night to feed your baby. In 6 weeks' time, the scar is roughly around half of the strength you want it to be. So over the subsequent weeks, it will reinforce itself and become stronger. We would therefore advise initially that you would avoid heavy lifting, as you not only have a healing scar, but also weaker, lengthened tummy muscles from the pregnancy itself. For more information on pelvic floor exercises, postnatal posture and advice on return to exercise after pregnancy, have a look at the HSE website mychild.ie, or contact your GP to get a referral for physiotherapy if you have any immediate concerns.
Welcome to Paediatric Physiotherapy Service here in Sligo University Hospital. My name is Rachel Wirtz. Congratulations on the birth of your baby. We have 2 physiotherapists who are specially trained in the care of babies and children and work in areas such as the neonatal care unit and postnatal ward here on level 4. In this video, I'd like to reference helpful and researched materials for your newborn baby on the following topics. Tummy time from birth. Yes, it starts that early. Prevention of flathead syndrome, also known as plagiocephaly, with advice on how to change your baby's position when they're awake, feeding and asleep. How important tummy time is and who to contact with concerns. Use of the infant car seat for car journeys only, and advice on type of car seats as your child grows. We encourage you to use lie-flat prams when out for walks. Playtime routines and various developmental milestones as your child grows. We do not recommend the use of baby walkers, jumperoos or door bouncers, as these devices do not promote the normal sequence of your baby's natural movements, such as crawling, pulling up to stand, or walking. Advice, videos, and other topics in relation to your baby can be found on the HSC website, mychild.ie. Just use the search box, example tummy time, and advice will be available. You can also use this website throughout different stages of your baby's growth and development, example sitting advice or type of toys your child can play with. Should the paediatric doctor refer your child to us for physiotherapy, we hope to be of support and provide advice to you and your baby. We may see them either on the postnatal ward or follow them up in the physiotherapy department on level 3. Wishing you and your baby all the very best for the future. Thank you.
Hi, I'm Ravi. I'm one of the consultant obstetricians in Sligo University Hospital, and I'm going to talk to you a little bit about postnatal care. You should make an appointment for your postnatal check with your GP or obstetrician. This should be done at about 6 weeks after the birth of your baby. This is an important appointment. Your GP or obstetrician can check that you are recovering from the birth and that you're feeling well. Your baby also needs a checkup 6 weeks after birth. Either your GP or a pediatrician can do this checkup. Your postnatal checkup and your baby's 6-week check can be done by your GP at the same appointment. This visit to your GP is a good chance for them to meet your newborn. It's also an opportunity for you to voice any concerns you may have and to ask questions. Consider making a list of any questions you may have before your visit.
If your child has stopped breathing, start CPR at once and continue until breathing resumes. Get someone else to phone for an ambulance. If you are alone, the baby should be brought to the phone with you when dialing 999 so that the emergency operator can relay precise instructions there and then on how to start resuscitation so that the delay is minimal. Lay your baby on its back on a firm surface. Remove any obvious obstructions. To open the airway, tilt baby's chin. Check the baby's breathing, and if there is no breathing after 5 seconds, give 2 rescue breaths. For rescue breaths, cover baby's nose and mouth with your lips and breathe gently into their lungs until their chest rises. Check for signs of circulation, which include any movement, coughing, or normal breathing. Start chest compressions if there are no signs of circulation. Place 2 fingers on the middle of your baby's breastbone, just below the nipples. Use your fingers to compress into the chest 1/3 of its depth only. Do this 30 times in smooth motions. Give 2 rescue breaths into baby's lungs and then 30 more chest compressions. Monitor the baby for any heartbeats. Continue with 30 compressions followed by 2 rescue breaths until the heart starts beating or medical help arrives.